All right, welcome everybody. Glad to have you joining us here today for this webinar on shifting from teacher-centered to learner-centered health professions education. So this is our webinar series team. It takes a team to put on these events for you. And I just want to say thank you to everybody on the team for putting in the work to make these happen. This webinar is hosted by Lecturio. If you are interested in learning more about Lecturio, you can use the link in the chat or scan the QR code that appears on the screen and learn a little bit more about us and how we can support your teaching. I'm your host today. My name is Sarah Keith, and I'm the head of learning and academic strategy here at Lecturio. And today I would like to welcome Lawrence Sherman. He is the president of Meducate Global LLC and a recognized speaker in health professions education. And we are delighted to have him today. So Lawrence, I will hand it over to you.
Why, thank you very much, Sarah. And I am going to share my screen, and then I'm going into slideshow mode so everybody can see it. Well, it is good to see everyone today, and there are so many people joining from so many places, and I love that. I am joining you from sunny Florida in the United States. I am originally from Brooklyn, New York in the United States. So if some of you need me to slow down, sometimes I speak so fast I'm like an ostrich running. This is a really, really cool topic, and I want to make sure that you guys know who I am and why Lecturio was kind enough to invite me here. I've been a health professions educator since 1994, and whenever I say that, people feel the need to put into the chat box that they weren't born yet. I don't want to know that, okay? So let's just keep this real nice and friendly. I have delivered hundreds of presentations on health professions education all over the world, in all of the WHO regions. So hopefully the content today will be relevant to as many of you as possible. You should also know that I have been a stand-up comedian, so if something I say is funny, it's okay. You can even put in the chat box that you thought it was funny. As Sarah said, I am the president of Meducate Global. We do health professions educator training all over the world. And I'm also a visiting professor of medical education at Zhongshan University School of Medicine of the Sun Yat-sen University in China. This is meant to be a workshop style webinar. So you've all done a good job of introducing yourselves. I want you to feel like this is a conversation and it's not just me talking to you. Whenever you see that little Bitmoji of me, you see me on the screen there, that's supposed to look like me in one of my Florida shirts. It means you're supposed to participate and put something in the chat box. And it really helps me to focus in and make sure that I'm meeting your needs. And I'm also trying to model for you a little bit how we engage with our students and participants. So it's really important to me that you do that. I wanted to start out with this specific needs assessment slide. I want to know why you chose to participate beyond the fact that some of you participate in many Lecturio webinars. I participate in those other webinars as well. But I want to know what about this topic is important to you. Why did you want to participate in switching from teacher-centric to learner-centric? What are your specific challenges? What would you like to take away from this session? If you can put that in the chat box, or if some of you can put that in the chat box, it really helps me to focus this. Oh yeah, so it's a hot topic. I know that people are talking about it all over the world. I'm going to get into that. So thank you, Nada, for being the first one. And I think you're right, Laura. I think the learners are evolving, so we have to evolve to catch up. And yeah, it is a priority for the students. And thank you, Kate, for using the audience term, because I think sometimes we forget that we're in that presentation mode. This is great stuff. I think we've put together, okay, Kelly, we're going to try to keep you guys engaged, and hopefully that'll help you find ways to keep your learners engaged. And I think it's really tough. I think we struggle sometimes as educators that we're giving them a lot of information, and we're up there, we're talking, and we don't know what's happening. So I really think that what we're going to talk about over the next 40, 45 minutes is going to hopefully hit all of this stuff. So thank you. Thank you so much. This is so helpful. I think we've planned the right thing, so I'm going to move on. You can keep putting stuff in the chat box, but we're really here to think about moving. So if we're going from teacher-centric to learner-centric, we're moving from teaching to learning, right? So we're shifting that focus from what we know to helping them learn what they need to know. In fact, I stopped calling myself an educator. I started calling myself a learning facilitator because my job is not to teach whatever audience I'm talking to everything that I know. It's more about helping them to learn what they need to know. And not every student, not every member of an audience needs 100% of the information 100% of the time, but you want to make sure that you're giving them as much as they need. And we're going to talk also a little bit about the why. Why are we presenting what we're presenting? And that why is really an important focus, so we have to think about that. And I think it's really about who owns that moment. Does the teacher own that moment? Does the student own that moment? I may ask you that a bit later. But one of the things I wanted to share with you is what we're seeing all over the world. And I am so glad that so many people from so many different regions have joined. I think we're going to talk a little bit about personal learning networks, and a few of you mentioned in the chat box about the evolution of the students. Well, the students put together their own personal learning networks, as we all do. And the components of these personal learning networks are changing. And we know that social media and AI are big. I'm going to talk a little bit about AI. I think social media, I think our students are going to TikTok and other resources where they're available, and they're looking for help on their own. And I think we have to be very intentional about how we help them and how we don't criticize them. And yeah, Victoria, I think you're right. I think sometimes we as educators and learning facilitators bear the brunt of the outcome of the students. And I think it's a good conversation to have. And yeah, I think the goal of helping your students to achieve what they need to achieve is really important. And we have to remember that our role evolves. I think back to when I was a student, we revered our professors, we revered our educators, and we felt that they were telling us everything we needed to know, and we sat there. And oftentimes, generationally, at least my generation, we didn't question as much as the current student generation. And I think it's great that they do. So we have to change to meet that. So, I think we have a gap. And I spend a lot of my time focused on CPD, continuing professional development. And we're all about those professional practice gaps. So a gap is here's where we are and here's where we want to be. So how do we move from where we are, teacher-centric in many cases, to where we want to be, learner-centric? And we have to be able to change. And sometimes some of the barriers are out of our control. And I just saw a word come up in the chat that's really important to me, and that's culture. And sometimes the culture needs to change before a strategy will work. So I think it's important to do that. And so we need to make sure that we're very intentional and thoughtful about the way we do this. Sometimes we have to manage upwards. And I think we have to be able to say, okay, the environment that we're currently in isn't learner-centric. How can we do it environmentally? And also, what little things can I do in each of my sessions with my students or my learners? What can I do to make it better for them? And I think that's what we do to close those gaps. So we know that the expectations of faculty vary greatly. We know that. We know that different faculty from different cultures, from different generations have different expectations. Some are very happy to move towards a learner-centered culture. Some are not. And the same is true for the learners. So we always have to think about, are our learners ready for a learner-centric culture? How do we make them accept that if culturally it hasn't been that way before? We also know that psychological safety is such an important focus for us. But we know that it's not the same all over the world. And we know that it's not the same from institution to institution. And we have to remember that learning and education should take place in a safe, non-judgmental environment. And if we move from one strategy to another, we have to make sure that everybody, faculty and students, feel safe and have their expectations heard. We also know that just the term engagement means something different to different people. And I think we have to remember that we have to set definitions. Sometimes, even when I do a webinar, sometimes I start with a slide that says the rules. And I always say your questions are encouraged, your comments participate, but that may not be the same for every webinar. So you may come in here with the expectation of listening and not having to or wanting to or needing to participate until the end where there's a Q&A session. I'm the opposite. I want you to engage. If something I say hits a nerve or it strikes a chord or it's something that you want me to expand on, I want you to use that chat box. I want you to tell me at that moment, because we've all experienced that time where we're sitting in a room and somebody says something, and unless you get clarification or make a comment, you're not going to be able to move on. And if you're feeling that, it's very likely that other people are as well. So I completely welcome comments and questions throughout any presentation that I give. Now, I also understand, I was just at a medical school in the Caribbean a couple of weeks ago, and the faculty there were saying that that's not something that they can do. Time is their enemy. They don't have time to answer all the questions. That's why they have to have office hours. So what you can do in that sort of situation is you can say, listen, I know that you may have questions that come up. If it's a critical question and you can't move on or you need clarification, ask me now. Otherwise, come to office hours. I'll stay here 10 minutes after the lecture, etc. Create an environment where they are heard. And that's really important. And like I mentioned before, that bottom right box there, when you're talking about cultures, there's a saying in management: culture eats strategy for breakfast, lunch, and dinner. And it's often attributed to the wrong person, but it really does resonate with me. If the whole environment in which you're operating doesn't support this, doesn't support learner-centered culture and environment, then you can have the greatest strategy to implement it, but it's not going to work until the culture around you changes. So sometimes it's a longer time period than you expected. So here we go. You see my little face there again? Use the chat box to share all the places that you think your students are currently learning and finding and seeking resources. I'm curious to see what people from different regions say about this. I know what I'm experiencing here. Yeah, Kristen, I know those are coming up, and we're going to talk about that Chat GPT thing in a second. And yeah, moving to that active learning comment above, I think that's important. And I think we raised the generation of learners who want to be spoon-fed, and I don't want to keep doing that. This is great stuff, folks. Keep it coming. And I think you're putting in exactly what I expected to see. I think people are looking at curated resources. They're looking at, they're using those AI tools. And I think what's really important is like I said earlier, we have to be supportive. We have to say, here's where I trust. Here's where I go. Here's what I think works. But here's where there are limitations to certain things. I spend a fair amount of time looking at health professions, educator, content creators on social media. And some of them are students, and they're as good, if not better, than some of the faculty that I've worked with. And I think that's really important to remember. And so, the students, while we tend to think of them as being a homogeneous sort of group, they're really heterogeneous. And so we have to embrace the differences amongst them as much as the commonalities amongst them. Yeah. So, Barbara, I love that. Using those games to help. People are engaged. They see it can be fun. One of the other things I'm going to talk about in a minute is also sort of sharing your passion for the topic that you're teaching. And I know one of the struggles is a lot of us are forced into teaching without any training of how to be an educator. Oh, hi, Chama. Nice to see you. Yeah, you want those students to feel included. You want them to be motivated 100%, 100%. And you want them to feel your passion for the topic. It humanizes you. I think sometimes we forget that people don't realize that we pursued something because we loved it so much, right? And I was working at another medical school a couple months ago, and I was talking with a biochemistry professor, and she said, my students just struggle. All I'm doing is showing them structures and talking about chemistry. And I said, have you ever shared with them why you chose that as the area that you wanted to go into? And they said, I never did. And I said, why did you? And she explained to me, and it was such a great answer. I said, that should be in your first session every semester. That is so important. And yeah, Mona, that's an important point that we don't want to forget, that the students are focused on the grades and the exams that they have to take more than the why is this important to me and why will it be important in practice. And yeah, it's the same reality, Rosa. I agree. So let's keep going on. So where do our students learn? Well, they learn all over, and I think your comments have reinforced this slide. So I think this is the right audience, and there's the right environment. Yeah, uh, Katrina, that's also an important point. They don't know how much they've learned, and I know medical students focusing on their standardized exams and nursing students focusing on their standardized exams and their practice questions. They're focusing on how do I just get through this? And I think there's that gap of some of them want to know why it's important. Some of them want to tie it into why it's clinically relevant. And other of them, for instance, in the US, just want to get through step one and they want to get through step two. And that's what they want. And the nursing students want to pass that NCLEX. And then the faculty have the challenges where they want to make sure that as many of their students pass the standardized exams as well. So I think it's a really important shared phenomenon. But I think we have to remember that there's a mixed sort of bag of where our students are learning. We like that formal education. That's where we're teaching. That's where we're doing the work, right? And one of the things to think about is the challenge in many medical schools where attendance is not mandatory at lectures. Lecture attendance has declined, but there was not necessarily always a corresponding decline in test grades because either students watched the lectures recorded at a later date, they reinforced it with other information, they were provided with that opportunity to move from that formal learning into maybe more of an informal learning. And this is the point I was making earlier. Our students are using multiple resources. Sometimes they're using the resources that we provide them, and sometimes they're using resources that they find on their own, and sometimes they're using a combination of what it is. And I think it's important to have the dialogue to ask them, so you all passed the last exam. What strategy did you employ to make sure that you were ready for that test? Now, some schools provide resources, as I said, some don't. So it's nice to hear from the students at the right time when you have time, what's in their own personal learning networks. And oftentimes they learn from each other. And quite frankly, we learn from them too. We learn where they're going. So then we need to take a look at it and make sure that we trust those resources as well. They may help us as much as they help the students, if not more. So people don't intentionally think about putting together their own learning network. It just happens. And that's right, Jihad. I think you're right. That was my point earlier, and you're reinforcing it. They are used to that traditional formal setting, but we can also help them to embrace the opportunity to put together their personal learning network, to know that there's other supportive tools so that they can go, because oftentimes in some of those environments, they hesitate to come to us and say, what are the resources that are available? Because I think in the older models, I'm not going to, that I'm used to, there was hesitation to question whether we had enough resources provided to us. I'm thinking when I was a student. So I think it's just really important that we think about that. Is this something that you all think about? Do you think about what other resources? Is that a stress point for you? Do you provide them with other resources? I know I don't have my little Bitmoji of myself, but you can feel free to put in the chat box. Yeah. So it's something I know many of us think about, and when we go to the larger conferences, whether it be AAMC or Amy or any of those conferences, I know these are the things we're thinking about. How are we making sure that our students are in the right environment to make sure they have the most success? Yeah, that's an important point. I'm going to talk about storytelling and anecdotes in a moment, and I think that blend of real world experience along with the information that needs to be provided, again, first of all, humanizes, but it also provides an environment of the why, not just the what. And I think that's important. And yeah, so if we're forced to teach online, we have to be better at sort of engaging online. And I do think that I like that, Michael, where you want to make sure that you're steering them in the right direction. And I think that's what we all try to do. I hope we all try to do that. But what we really should be trying to create, and I don't know if this is something that all of you have thought about, but it's we shouldn't just create these little vessels of information. We should create students who will become practitioners that remain curious, that when a question comes up in clinical practice, we've taught them that they should consult the right resource, test out what they found, and then determine whether that's something that they should be doing in clinical practice. It's this master adaptive learner approach. It's something that I'm greatly interested in, and I think it's really important. And so if any of you want to learn more about master adaptive learner, just sort of shoot me a note and I can send you a paper or two. It's a very interesting topic. So instead of just saying, here's what you need to know, it's really helping them to have the structure of knowing where to go. And just so you know, one of the things that I build into some of my teaching is improv from my comedy background. And I often use this to help health professions educators to become more adept and to be better at responding to questions and interacting with their students. So I think there's a lot to be said for using innovation as educators whenever we can. Okay, Karen, shoot me an email. There'll be some contact information at the end, and I'll send you some information about that. So I guess the question is, if all of this learning is happening everywhere, what's our role? How is our role shifted? So I think it's really important that we sort of have some self-awareness, and we're thinking about self-efficacy and how well are we doing. And I think it's really important that we get some feedback from our students as well. So how do we make this shift from teacher to learner-centered? So it's moving from giving all that information to helping them to process it, to make them co-creators, to make them a part of the process. And as some of you have already said, that's that clinical application and clinical reasoning. And so I think that's really important. And Zahid, I hope one of the takeaways from here, I hope, will be what the options are for what you can do to be a better planner or educator. Yeah, and Mike, that's right. We're not saying do as we did. We're saying here's how you should go. Here's the resources. We're helping them. We're guiding them forward rather than saying walk in the same footsteps that I follow. And so the other thing is, I'm sure you've all used the term teachable moment. Well, I'm sort of saying let's create learnable moments instead of teachable moments. Teachable moments are what we think are the things that are important in a lecture, in a presentation, in a course that should resonate with the students. I think learnable moments are the ones that the students identify. And that's that moment of engagement. And I think we need to create the opportunity for the students to know that they could say, that's important. I didn't realize that. That's what I think the focus should be. That's what I needed to make this make sense to me. But it really, you have to change your mindset in doing that. And so as as the students change, we need to change. We know that. So here's another question for you. There's me again on the screen. As you're thinking about your last impactful teaching moment, something that really stuck with you, was it a teachable moment or was it a learnable moment? Meaning, did you create it or did the student identify it? And it doesn't matter. There's no wrong answers here because there will still be teachable moments. We still are the expert on the topic. We still are the ones who are guiding. That's great. It's nice to be able to recognize that both sides, that's that co-creator point, right? So it's really important. And so, yeah, Jihad, I think for many of us, it's that teachable moment. And sometimes we have to tell the students it's okay to share with us when there's a learnable moment. Make them a part of the discussion. Yeah, that's Abu. That is when I present live in a conference. If the participants are talking more than I am, it's a win. It's absolutely a win. And Ronald, that's probably right. There are some things that are learner-centered and teacher-centered. Excuse me. I'm going to take a sip of my water as you continue. Yeah, Rosa, that's true. I agree with that as well. So it's interesting that several of you have said that what you've experienced are moments that are both, and that's great. And why is that great? It's because you've identified something that you thought was important to teach or an important way to teach something or describe it. And then your audience or your students have said, that's important. That's what I needed to hear. So there's that overlap. If you think of a Venn diagram of two circles, that's that point of overlap. And it's what you want to say, what they need to hear. And that point of overlap is the relevance. And that's where the teachable moment and the learnable moment coexist. I love that. And you're right, Michael. I think that's exactly right. There's never a presentation. There's never a lecture. There's never a session that I've given where I didn't take something away as well. And I think that's really important. You guys are great, by the way. You guys are engaging much more than I thought. And I just have to make a side note. It is so nice to see some of my friends and contacts, including someone I went to undergraduate with who's been commenting in the box. This is fantastic because you guys are helping to shape this session. And I think it's important that we all do that whenever we can. I mentioned earlier teaching the why. There's a great TED talk by Simon Sinek that focuses on sort of the why. And I think sometimes we forget, some of us forget to talk about the why something is important. But the why often makes people remember something better. And it supports that transfer to practice. It supports the ability to take what an important point for us and for the students is, and how does it become relevant to them in what they're going to be doing. And why also helps them to think, right? It helps them to go through the reasoning of why something is important, why something is relevant, why something should be taught. Yeah, it is the Socratic method, but so many people don't think about the why, and so many people don't delve in or take the 5 whys approach or so many different things. And some of the challenges that I hear now, you may not share these, but some of the challenges that I hear all over the world, and I mentioned this earlier, is that a lot of people are asked to teach in lots of different environments, but have never been provided with training or resources in how to be an educator or how to be a learning facilitator. So many people wind up just doing things the way it was done when they were a student. And we know that we have to be able to do that. And yeah, we want to sustain that critical thinking, Rosa. I think it's incredibly important. And I'm going to say again, thank you, thank you, thank you for making this a conversation. This chat is going better than I could have expected. But what happens? So if we leave out that why, if we leave out the why, then we're just given a bunch of facts. And while that's important, maybe it restricts competence, the ability to apply what they learned, or it slows it down. And maybe there's that gap of teaching to doing. And maybe there's the gap in how to do that clinical reasoning approach. Yeah, I like that, Amal. You do it the way you wish it would have done for you. That's fantastic. And yeah, Kat, I think that's important too. We have to remember that sometimes that our students, as we said earlier, it's a heterogeneous group of people, so they need different types of resources. And I think we need to think about this. We need to think about the differential diagnosis, that approach, much earlier than it is included in some curricula. We need to think about that clinical reasoning and be less rigid, more flexible. I think it's really important. I think we also have to remember now, I don't know what environments you teach in. If you're all in undergraduate education, medical schools and nursing schools, where most of your students are not coming in with tons of life experience, well, we are focusing on pedagogy. We hear that word a lot, but we have to remember that there's a continuum. As we grow, as we mature, the way we learn changes. So pedagogy moves to andragogy. Pedagogy is teaching students. Andragogy is teaching adults. And adults learn differently. I could do a very long session, if not course, on how adults learn. But I think it's important to remember that there's an evolution. So if you have a mix of your students who go from the youngest of the young to the oldest of the old, that their brains are functioning differently. And we have to try to appreciate that we need to teach in different ways. So students are absorbing this stuff pedagogically and they're taking it all in. But even now, I think the switch from pedagogy to andragogy is happening earlier. And as they mature even further, they get to self-directed learning. That's that hudagogy. I'm not going to spend a lot of time on this, but I did in the intro to this session that went out with the invitation say that we're going to talk a little bit about learning science. This is the learning science that matters here. We have to understand how the learners are progressing. How are they expecting to learn? How do they learn? What's driving them to learn? And how do we meet them in their lane and not expect them to just come to our lane? So we, as the faculty, we have to promote that connection. We have to promote that discussion. Oftentimes, I think of that faculty being behind a podium and the learners being on the other side. And to me, that's almost a barrier. And I don't like that barrier. Any of you who have seen me present live know that I don't stand on the stage behind the lectern unless I have to, because that's the only place there's a microphone. I'm a bigger believer in being on the level with my students, or learners or audience, and look them in the eye and talk to them. But we also have to set the expectations for the learners. They have to know that they can engage, and they have to know what their roles are here. Absolutely. Michael, you know me a long time. There has never been a time where I didn't think about working the room. And I hope back in the day, Michael, I hope I modeled that for you. But I think this learning belongs to the student as much as it belongs to us. And I think that's what's really important. Thank you, Michael. It's nice to hear. And remembering who's there for whom. The students aren't there for you. You're there for them. Now, the learners are there for themselves as well. So there's that shared responsibility that we have to remember and we have to embrace. And we have to say, this is really important. Now, I'm not going to spend a lot of time on this at all. But remember, what's going on in that learner's brain, that student's brain, is so complex. And all we're trying to do is give them the right information in the right setting at the right time for the right reason. And there's far more than 10 principles of learning, by the way. But this is one of my favorite slides because it reminds me to remind you that so much is going on. The other thing is, especially if you're teaching in an environment where students have prior work or learned experience, that things change. And so one of the hardest things and one of my current areas of interest is unlearning. So how do you get somebody to stop thinking the way they used to and start thinking the way they have to? It strikes me that this week there was a big cardiology conference, the American College of Cardiology, and new guidelines came out as far as lowering LDL cholesterol. And the targets have been moved much lower. And there are going to be a lot of people, cardiologists, primary care physicians, and other healthcare professionals who say, you know what? I'm comfortable. My patients are doing well. I'm not going to aim for 55. I'm going to aim for 70, and I'm going to be good with that. Or, Mike, this is going to resonate with you. I don't know how many of you have had to take or teach ACLS, Advanced Cardiac Life Support, but every couple of years, the guidelines and protocols change, and we have to change the day those protocols come out, the way we manage a patient in cardiac arrest. And there's a lot of people who say, I'm comfortable doing it the way I did it. I still remember how I did it when I first learned it, but it's way different than the way you do it now. So we have to remember that part of our teaching is we have to get rid of that educational residue that's gunking up the brains of our learners, and we have to make room, help them make room for this new information or this updated information. Yeah, I remember those, and lots of bicarb, Mike. But that's that thing. There's that stuff that we have to chisel away. We can't assume that everybody is just ready for that information to come in. There's a whole other topic that we could talk about, which is readiness to change. So some people are more ready sooner to make a change, and some people take a lot longer to make a change. All right, here's another question for you guys. We're about 10 minutes from the end here. So what's the role of AI in learner-centered health professions education and what we're talking about? And I'll just give you a couple of seconds to say, and you feel free to say it has no role. Feel free to say it's got every role. Feel free to say people are using it. I'm just going to give you my top level thoughts on this. But I'm going to take a sip of my water again, if you don't mind. Thank you, Mark. You may have a moment where you see me use that word augment as well. So keep putting it in there, guys. I think AI is perceived as a threat by many health professions, educators, and I don't blame them. And I think part of it is because they're not sure if AI is going to take over for them. And I think that's a fair question. But I think the reality is faculty and students can definitely benefit. Oh, it's interesting that you say, Amal, that it makes you funnier. I think, I don't know, I think I'm funny naturally, but maybe I could use AI to make me funnier. I'm going to try that. But I do think there's that word. See that? Augmented. It's like you were way ahead in my slides. But I think if we use it right, it supports our ability to be more efficient. So many of you have said in test questions and assignments, there are some great AI tools out there. And I think it helps the learner feel like they are a more active participant. But we have to remember a human always needs to be in that process, right? Because there are things that happen. I read something today on LinkedIn where somebody corrected someone who posted about hallucinations in AI. Oh, and there it is, hallucinations. Somebody said that the more appropriate term is a confabulation because of what AI is trying to do. The AI tool is trying to please you. So it's not hallucinating. It's changing what it's saying to you because it wants to please you. So, and yeah, I think drifting is a great word. But I do think the risk is uncritical use, if we don't have a human involved, we need to be able to even teach our learners to evaluate whether the tools are right or wrong. For instance, if they're using AI generated questions, what's the knowledge bank that the questions are being built from? If it's being built from the interweb and anything that's out there, we don't know that the resources that they're consulting are correct. So there's an art to prompt engineering, and there's an art to being critical, and there's an art to saying to the students, you need to fact check as well. So I think we can't ignore it. I didn't want to ignore it. And I think we need to move on. In the last few minutes, I'm going to talk about engaging with the learners and storytelling just real quickly. What I like to do is I like to start with a question. And I don't move on until I get an answer. I know sometimes if you're in a course, you don't have time. You have a fixed amount of time to reach your objectives. But I absolutely recommend trying to open with a question. And I love making it a conversation. Again, what I hear a lot, and I understand, is that oftentimes time is your enemy. And I think it's important that if you can make it a dialogue, it's important, and check in. And sometimes simply saying, guys, have I completely blown you away with this? Guys, are you understanding what's happening? Just asking that question, by taking that intentional pause and asking that question, is a big deal. And so there's lots of ways that we can do this if we have the opportunity to do it. And I think we can intentionally engage and really make it a foundation of how we teach. And I think we need to be able to do this rather quickly. We need to be able to build this in. Now, not everybody wants to do that. Sometimes you just want to get from A to Z or Z as quickly as you can. But we have to remember that everybody's going at a different rate. And I think it's really important. I like that. Our virus is alive. I like that. Very briefly, storytelling isn't just about telling a story. Storytelling is the process. Storytelling is starting at the beginning of your session and getting to the end of your session through that story arc and making it contextual and maybe building in anecdotes if you can. But it's not just saying slide 1, this, slide 2, this, slide 3, this. It's more about telling the story. I hope you think that I've been doing that so far. There's been a story arc here. And I think we're sticking true to that story arc. And this goes way back, right? A story has a beginning, a middle, and an end. And what you want to do is you want to make sure that you're basing it on what you're trying to teach, that your session progresses well. Sometimes when I'm putting together a presentation, it just doesn't seem to flow. And that's that storytelling arc that's being interrupted. And you have to figure out, how do you make that transition smoothly? And if you want a structure, this is a little bit of a structure. Why does what I'm talking about matter? Why is it important to me? It goes back to that point. Why do I love this so much? And here's what we know, and here's what's going to be coming, and here's the implication of it. Yeah, Ronald, I agree. I think if you start with the why and end with the implication, I think it's a really good structure to every session that you do. And I try to do it that way. I touched on this before. I think this is something that we think about a lot. Do we teach to the test or do we teach to the topic? And I think we have to make sure that we reinforce to the students that we are teaching what they need to know to both become a professional and to pass their exams. And I think there's so much focus by the students on the exams that they miss why everything else is so important. And I think that's a gap in many, many places. And I think it's we and the students both play a role and make sense. And yeah, that point in the chat box is really important. It's if you use an anecdote, and I want to use the term anecdote instead of story so we don't confuse the storytelling. Storytelling is the process by which we're teaching or giving a presentation. The anecdote is the story that we build in to reinforce the point, but they need to be real, they need to be relevant, they need to be current, and they need to make sense, and they need to be evidence-based. So as we sort of wind up here a little bit, we have to remember that we're focusing on both learning and teaching. And while we love those teachable moments, we want to help the students find learnable moments. We want to make sure that we don't forget the why. We know we want to engage as much as we can, and we know that we want to use AI to enhance the learning. What will help me now as we're going to transition over in a moment, I have another slide, Sarah, so don't take over quite yet, is can each of you do me a favor? Because this helps me understand what resonated most with you, is share one take-home message from the discussion that we had today. And I hope you feel like it was a discussion that you were involved in, that I commented as much as I could. You were commenting a lot in that chat box, but share one take-home message with me. And I thank you. There's my email address, or you can scan the QR code. And this was an absolute pleasure spending the last 48 minutes with you. And I gave us enough time so that if we need or want to do a Q&A, we can do that. And then there's something afterwards. But I want to make sure that, one, I see oh, thank you. These are great take-homes. And what's really interesting is there are different take-home messages for different people. And I think that's important because we're all different. And I think it's a lot of fun being a learning facilitator. And by the way, thank you to those of you who have never heard of the company that is putting on this webinar before, but know me and have joined this webinar. This is fantastic. So with that, Sarah, you are welcome to take back over the control, and I will stop sharing.
Excellent. Thank you so much, Lawrence. That was great. I learned a lot. I loved reading the chat and seeing what everybody had to contribute. And if you're okay with it, I would suggest we do that for the Q&A, that we have folks ask questions and you can answer. And then if other people have answers they'd like to share in the chat, I would love to just keep that discussion going. So if you have a question for Lawrence, please share that. We would love to hear from you. Let's see. Here's one. Students are using AI to summarize my summaries of a large amount of content. Basically, I'm worried about developing misconceptions of those concepts, the copy of a copy effect, that we're degrading the content. How can you help students with those kinds of issues?
Well, so that's great. And I have tested out some of these platforms. The one that I like the best to summarize is actually Notebook LM, but not everybody has access to that. But what I suggest is that you look at some of these summaries of summaries and see how they are, and you be that critical human involved in the process and tell the students you want to make sure that these are as good as they can be. So you want to take a look at the first few. And I think they'll appreciate, rather than you saying, maybe that's not a good idea, or maybe there's challenges, say, put me in the process. Let me take a look at these, and maybe I'll start using that platform, something like that, so that you become relatable in the topic as well. And I just want to point out, so a lot of you are saying hutology. It's actually heutagogy. I'm going to type it in the chat. But I'm glad, yeah, that's very new to a lot of people.
Could you speak on that for just a moment on heutagogy? I know it came up on that slide as a comparative to andragogy and pedagogy, but maybe you could just speak about that for a moment, because I've seen it come up a few times in the chat.
Sure. So as we mature, we learn differently, and our brains are different because of our life experiences. So we go from being a kid to being a grown-up, and being from a grown-up to being a professional. So when you're a kid, you learn pedagogically. You expect everything to be provided to you. So it's the learner-centered. Andragogically is more of you're driven by questions in clinical practice. So you have that experience based. So it's sort of learner centric rather than teacher centric, to use the title of our session. But then you get that freedom. You get the ability to be self directed. You get the ability to seek out what you need on your own. So it's self determination and it's self direction. So it's that you go from being the most constrained to being the least constrained. You go from having the least control to having the most control.
And just kind of a follow up to that, how, if we were just going to ask kind of a blue sky question, and please also feel free to answer this in the chat, how might we use AI to support that with learners?
Well, AI is the perfect example of it. The AI is, if we're self-directed, we're going to use tools that we trust to find the answers to our questions. But we also have to know that part of seeking out your own answers is testing those. It goes back to that master adaptive learner theory. You can't just accept what you find as the truth. You have to be able to question it and make sure that it's right and validate it. And we have to stay curious.
Yeah, absolutely. Um, Another question from the chat. I feel the more we involve the students, the more demands they have. As you talked about that heterogeneous population. So how do you meet all of those needs? Can you meet all of those needs um, while being learner centric?
Yeah, a fantastic question. And I think you're never going to make everybody happy. The reality is because of that heterogeneity. So part of it is to involve as many of them that want to be involved, but also give other people the opportunity to stay in the more structured environment. That's that differentiator of those personal learning networks. Some people need far more structure. Me, structure is my enemy, right? So for me, I like the freedom to find what I want, but I also have the competence built over time to test out whether what I found was right or wrong and whether I wanted to be involved or not. Forcing anybody into any situation is going to cause problems. So the more flexible you can be, the better it is.
Excellent. And then we have a question about what do you suggest is the best way to have students using AI effectively in courses and assignments? I know you spoke about the summaries. Of course, perhaps you could have students generate summaries with different AI tools and compare them to see if one was better than another. But what are some other suggestions that you might have?
I think the reality is to turn it around on them and say, okay, how are you using it? What has worked? What has not worked? And make them part of the conversation rather than saying, I have the answer because I don't, and we don't. And we know that the AI is going to be different tomorrow than it is today. That's an important point Gilberto just put in there. But I think we have to remember that if we involve them in the conversation, it almost it disarms them a little bit and it creates that comfort zone, that safe space to have the conversation to say, you want to look at this, you want to think about this. I think that's really important. And if I could just comment on what Gilberto said, yes, and it's important to remember that every one of those exams and every one of the choices needs to be double checked at first because 99% of it could be right, 1% of it can be wrong. And that 1% may create that learnable moment for that student that they learn the wrong thing. And if they fail a high stakes exam because of one question that ties back to that question, whose fault is that? So I think we just have to remember that the human has to be a part of that conversation.
Yes.
Yeah, Wendy, I'm sorry. The thing about Google Notebook LM, I put an article that I wrote into Google Notebook LM, and it created a two-person AI podcast discussion of the article, and they got everything right. It blew my mind. And the people sounded so real. I believed they were people. I wanted to meet them.
Yeah. I like Notebook and those kinds of tools where you can limit the information that it's pulling from.
Mhm.
I would agree that that definitely generates better results. We do that in Lecturio. There's an AI tool where you can search and ask for answers, and it limits it to the Lecturio library, which is extensive, but you know it's not just going and getting something from some random blog on the internet. Okay, and then Wendy asks tools that limit that data set. Yeah, Google Notebook is one way to do that if you have access to the resources already. Lecturio offers that, limited to our library. And your school may have subscriptions as well to things, so I would definitely check with your institution.
You can also, again, it takes some prompt engineering, but you can also design a prompt that you use every time, or that you direct your AI tool to only use validated resources and to provide a confidence level in the statements that they make. I have this it's in every one of my chat GPT searches. It's intrinsic. So I see what the highest to the lowest validity is, and it's very helpful.
And one great question to ask your students is, what is AI doing well for you in your study and in your learning? How is it working well for you? And where is it not working well? What have you tried that didn't work well? Those are great ways to learn from your students, for them to learn from each other, for them to learn from their own experience and reflect on it. Those are excellent questions to ask. So, okay, well, if we've exhausted the questions, then I'm going to thank Lawrence for speaking for us today. That was so great. Thank you to everybody in the chat for your participation. Really appreciated that. I'm going to share a few slides with you here at the end to answer a couple of the questions that I saw in the chat. And if you are interested in learning more about Lecturio, who is sponsoring this webinar, please stick around and I'd be happy to share more with you about that in just a moment, and might even show you a couple of those AI tools that we've talked about. So we've had our Q&A session. I thought that was wonderful. Again, if you want to learn more about Lecturio and our platform features, you can use the link in the chat or scan the QR code that's up on your screen, and we'd be happy to speak more with you about that. Lecturio also offers, as part of our learning ecosystem and teaching engine, we have Simtics by Lecturio, which is interactive simulations of real clinical procedures. It's a really exciting platform. If you're interested in that, that's something you can also get a demo on. And then for clinical reasoning and diagnostic reasoning, we offer Healer, which was originally created by the NEJM group. And it's a great way to have your students practice diagnostic reasoning and clinical reasoning with cases. So you can scan that QR code or use the link in the chat to learn more about Healer. If you enjoyed this webinar today, I would welcome you to join us next week, where we will be talking about team-based learning. And you will learn some of the ways you can use the Lecturio platform to facilitate team-based learning within your class. So it's going to be the same time next Wednesday. I hope that you'll be able to join us for that. And if you'd like to reach out, you can contact us at learning-science@lecturio.com. We'd be happy to speak with you. So thank you to everyone for joining us today. I really appreciate your participation. Thank you again to our wonderful speaker, Lawrence Sherman. We appreciate that so much. And I hope to see you next week.